Good morning, good afternoon, good evening. This is Dr. DeShavo, and we are here for week 9. So, most importantly, in week 9, we have exam 3. Make sure that you take that in a timely manner. It will open, did not put those dates in yet, but I will. At the end of the week. I'm not sure why I can't see the dates here. Here we go. July 21st to July 24th. Please remember to access it through RP Now. Now, for week 9, we have exam 3. Couple important things. You must show your ID. Several of you are getting flagged for not showing your ID. Don't want to get flagged, right? Show your ID. Several of you have been flagged for looking away from the screen. You cannot look away from the screen. Okay? So please make note of these things and follow the directions. I always tell my students at the other universities I work at to scan the area well. Take your computer, spin it 360 degrees. Yeah, almost said 300. Is that a full circle? Yes, 360 degrees. Show up, show down, show underneath your desk. I would avoid sitting on a bed. It's just going to minimize any chance of us saying to you, you're cheating. Okay? So, for week 9 work, we are getting into the function of blood and hormones. So, with the blood, we have multiple things that the blood does. And this is actually why we have endocrine system, which is the hormonal system, rolled into it, because the blood has red blood cells, white blood cells, and hormones that run through it. Whenever we think of hormones, the way we get hormones from point A to point B is through the blood system. So, blood is not just red blood cells, it has white blood cells, it is hormones, it is one of the main regulators for pH, it transports nutrients, oxygen, does a ton of stuff. So, we go through the structure of the blood, how it changes with elderly, how it's different with infants, and then how the endocrine system works in collaboration with that. Discuss the structure and function of the renal. It shouldn't say renal, it should say endocrine. Okay, so we already covered renal. And then as we come down, here's all your PowerPoint notes. I've pulled a couple of those up to review some questions and also short reviews for all the chapters. And once again, this is a great way to practice. You can write these words down, write the definitions, or better yet, study and then see what you remember from these words. As far as the discussion, we only have one this week. For the discussion, some people are posting discussions and or responses that are too short. Please remember that it is required to have 250 words. Just as a sidebar. Now, looking at some of the notes for this week. Okay, this is the overview for endocrine. And it goes through a lot of the diseases and has some pictures that you can review. But this question, I wanted to practice reviewing the questions once again. So read the question, and what I tell my students is to think about the question. Don't just read it and jump right to the answer. Don't even look at the answers. So a 12-year-old patient develops pancreatic atrophy with loss of beta cells. So within the pancreas, we have what are called islets of Langerhans. You may or may not remember that from anatomy and physiology. And within the islets of Langerhans, we have several cells. The two main ones that we focus on are beta cells and alpha cells. Alpha cells help to regulate glucagon. Okay, and you'll review this all in your notes. Beta cells help to regulate insulin. So If we're regulating insulin, if we have a pancreas and atrophy means to shrink. A means like without or less of atrophy. When muscles atrophy, we see that the muscles decrease. So atrophy will be a decrease and a loss of beta cells. Probably it's going to have some sort of link to diabetes. Okay. Type 1 diabetes is insulin dependent. That's often found in young people. Type 2 can also develop into insulin dependent, but that tends to be more weight gain related, and it goes through phases where quite often it starts where you do not need the insulin, but later on the beta cells become tired of being overworked and you end up having to take insulin. Okay, so once again, read the question carefully, think about it, then choose your answers, and don't forget your experiences and what you remember from that. Okay, so just going through some of these, there's more questions that you can review. Use these questions in lectures as practice for taking test questions. Okay. Here's one of the PowerPoints for blood. And I wanted to bring up this one, review this one, and I'll tell you why in just a second. Which are the most abundant cells of the blood responsible for tissue oxygenation? So this should already be sort of ringing a bell with you as red blood cells. We know that. You probably know that from some of the blood work, but what is the actual name for it? Okay, red blood cells, what are they also known as? They are known as erythrocytes, which would be here. Probably sounds familiar. But I also wanted to point out this prefix. Starting to know some basics of prefix and suffixes are a good idea. Leukocytes, that prefix means white. Those are white blood cells, okay? Platelets help us with clotting, and then neutrophils help to fight off bacteria. So the answer for this is erythrocytes, but I also brought up this question because leuko as a prefix and lymph, people get those confused quite often. Leukocytes are white blood cells. Lymphoid or lymph refers to the lymphatic system. So that's a series of organs, including the spleen as one part of it. We probably know a little bit more applicable lymph nodes and all those series of vessels that run through the body that help with fighting infections, but probably more applicable to you all is knowing that it also drains excess fluid from the tissues. Both functions are important, but you probably know that from patients you've worked on. That's why we have support hose if their lymphatic system is not working properly. Okay. So, treatment for iron overload. This I just find interesting. I brought it up, and you probably know this. Treatment for iron overload, this is a little bit tricky because vitamin C does help with the absorption of iron. We don't want that if we have iron overload. In some cases, people are genetically predisposed to storing excess iron in their tissues, specifically their liver. So, in order to get rid of that, the answer is phlebotomy. Okay, and removing some of the blood, which will remove some of the iron. And hopefully when that patient regenerates their blood, they won't have as much iron in it. So I thought that was an interesting one. And this is another part of the blood that you study and the diseases that go wrong with that. Okay. And as you're going through, one of the things I noticed, of course, there's so much in here. Try to look at things that stand out with some of these diseases. I know a lot of them start to seem familiar. You want to look for things that stand out that would help you differentially diagnose them from other diseases. And the last set of notes that I wanted to go over. Okay. I brought this one up because this one I see this pop up quite a bit. So there is different lymphomas, and a really stereotypical pathognomonic is the way that we can phrase that. Some fancy sign and symptoms of Hodgkin's. is that painless lymphadenopathy. So if you have a patient that has a swollen lymph node and it's painless and it's been there for a prolonged period of time, or even worse, multiple ones, it could be signs and symptoms of that Hodgkin's lymphoma. Sorry about that. Tripping over my own tongue right now. Sickle cell disease is another really good one to review. That sickling shape where the red blood cells are not rounds. They're sickle. I don't know if you know what a sickle means, but a sickle is used to chop down meat. So it's got that curved half moon, quarter moon appearance. And that's how the sickle cells present as well. And then they go through and review some of this. And then these are disease processes with children, unfortunately, which I'm sure is very sad to see. So that is just a little bit of review that I wanted to go over with you. As always, if you have any questions, please feel free to reach out, and I hope you all have a fantastic week. I wish you the best of luck on your exams. Read every word of the question and the answers, study hard, and do well. Have a great week. Take care. Dr. DeShavo out of here. See you.